Half a day. Now we're here with one of our psoriasis patients, and we're going to do a treatment with another light source, which is called Levia, and it is a narrow band UVB targeted light therapy that we can use for specific plaques when patients have just small areas of psoriasis, especially on their scalp. This is a painless treatment. It's very effective, and I'm just going to show it to you. Do you mind just leaning forward? Okay. So we're going to just show some of the spots that our patient has on his back. These are some psoriasis areas, especially right here. And this is thick and itchy, and he's tried a bunch of creams and things haven't really worked out as well for him. So we use our machine to send small amounts of very specific wavelength of UV light right into the spot. So it looks kind of like a blow dryer. Doesn't hurt at all. It's a cool light. And we just apply it like that and do the treatment. And he's had one treatment several days ago. Does that hurt at all? No, not at all. Okay, that takes about 5 seconds. And then these are areas, if you just look down here, these are areas where he's had treatment a couple of days ago, where it's just red. The plaque though is shrinking and drying up and going away. And he'll come in and do this 2 or 3 times a week for a few weeks, a month or two, and these plaques will all go away and he'll be very comfortable. And this red side effect that we have from the light treatment will also go away without any scarring at all. So I'm going to now show you what we do for the scalp. So now we're going to change it to the head thing, and then we're going to actually do your treatment. So here we are with our patient now to show some of the scabs that people will sometimes get on their head. These are called plaques, psoriatic plaques. You can see the dandruff here. This is something that people struggle with when they have psoriasis. It's embarrassing for them. They feel very awkward about it, and it's not something they can control. It's not dirty. I'm not afraid to touch it. I'm not going to get any disease, or it's not contagious to me, but other people might make judgments about it, and it's very difficult for the patient, and plus it's very itchy. So if you just focus in on a little bit, I'll show you a little bit more here at the top of the head. Okay, this is what we struggle with here. And sometimes on the back of the ears. I don't know if you don't have any back there today, just at the front mostly. Sometimes it'll be the back of the ears as well. But you can see how he would need to wear a fringe or bangs to try to cover that up. And we're going to clear it with our light source. So here we go again, very easy. This one here is an attachment that I use that sends UV light through the prongs. I'll show you that. Basically, we just apply it like this. And wait a second here. Here, now we're going to get going. So the UV light is going through the little prongs and helping his skin get better. Now how does it do that? It changes the immune system. The problem with psoriasis is that the skin flakes too quickly. Instead of getting a new layer of skin every 30 days or so, our patient is flaking and getting new skin every 5 or 6 days. So it's very dry, very red, itchy, inflamed. And what the UV light does is it changes our immune system without any side effect except the mild redness that you saw in the back. No pain, no medication, no side effects at all. And this will clear very nicely over the next short while, over the next month for sure. As far as once it's clear, as we know, psoriasis is not a curable disease, it's a controllable disease. So he may anticipate getting future plaques again and down the road. Triggers for that tend to be stress or sickness of other kinds, especially diabetes or strep infection. So he may get other plaques down the road, and so we can do this as maintenance therapy. We can do this a couple times a month just to keep things under control for him. So painless, easy for him to do it. So Mindy, this is our third patient here today who has the most typical kind of psoriasis that you'll see here on island. We've seen a couple of examples earlier. And if we look over here at his elbows, knees, back of the ears, tummy, these are areas that are affected by these dry plaques, which are incredibly itchy. Sometimes they're very thick, sometimes they're not. No food intake really affects how they appear. There's no food that typically aggravates it or makes it better, except for, as we talked about, weight gain will make it worse. If your diabetes is out of control, it will make it worse. And if you're under stress or sickness of some other kind, it will make it worse. Another area that will get affected is here behind the ears, again causing dry flaking patches and dandruff, and source of embarrassment for the patient, as well as difficulty sleeping because of their itch. Thankfully, again, ointments help, medications can help us as far as oral medications or even shots, and our UV light therapy.